Thank you so much. So yes, my name is Millicent Alooh. I'm a biomedical engineer by profession. I work with Health Active as the head of technical services currently. I previously worked with Nest 360. I know Hatishi probably might not be aware, but I transitioned to Health Active. And I lead the Association of Medical Engineering of Kenya. That is AMEC again, not ABEC. ABEC is in, I think, in another country. But yes, this is AMEC. So that's me in a nutshell. So I'm here to talk about the MedTech talent in Africa. Yeah, and thank you so much for the team who have talked about the AI, Jeremy, Lona, and Dr. Mzuri. It was very interesting to hear what you're having and how much you're supporting the team, the talented team around. So I'm here as an advocate of MedTech talent in Africa, just to see what is there, how can we support this team, how can we work together as a team, and how can we ensure that we are sustained. So I'm an advocate of the MedTech talents. That's what you can see over there. That's a photo of us talking to young upcoming talents. Today, I think I've seen quite a number of young faces. And I think I'm allowed to say that there are so many young people in the room. I'm now old. Yeah, in terms of age. I feel old, actually, now that I have so many young people in the room. Yeah, so MedTech talent in Africa. Yeah, so allow me to start by saying that Africa's greatest MedTech potential is not in our hospitals, it's not in our labs, not even in our funding pipelines, but it's actually in our people. And who are these people? The engineers, the innovators, the dreamers who can reimagine health for 1 billion lives. Now we are no longer talking about 1 million lives, we are talking about 1 billion lives. So the Africa MedTech potential is just on our people. Now, on my outline on the MedTech talent in Africa, I'll be highlighting some state of technology in Africa. I know I've seen that so many of us are very familiar with. I'll also talk about the talent gap, what is there and what we've been able to identify. I'll give also some of the available opportunities that we can actually take advantage of. I'll share my vision of the MedTech talent in Africa, and I will request us to share with me the same vision. And now I'll have a call to action for the same. Now, I know a number of us are very familiar with this state of equipment in various facilities in Africa. I've been privileged before to work, and even now, to work in various African countries, visiting a number of hospitals, both remote and those ones that are advantaged to be in the city. And I've witnessed a number of incredible machines sitting idle for months, for years, and even for decades. And I ask myself, why do the incredible machines sit idle for months, for years, and for decades? And I realized one thing that I know a number of you will also share with me, that these machines are not sitting here because they are beyond repair, or maybe because they are not needed. But it's because we do not have trained talent to have these devices fixed. We don't have a very robust system that can be able to support the team to manage these devices once the very good innovators who are here have released the devices to the market. And also, we really don't have a very robust local pathway for local innovation to thrive in. So this is a scene that is very sad. And a number of hospitals, especially the government, public facilities, so to speak, will have quite a number of these particular devices there. And they actually even create like an entire yard, a place that can be fit or good enough to have a whole ward, or maybe newborn babies or maternal, or maybe even just diagnostic room for the IVD. But then you find that a hospital or a facility has decided to dedicate such kind of a room, and just because we are lacking required talent. Now, I think a number of times we always think of MedTech as equipment. The baby incubators, we'll be talking about the MRIs, the CT scanners, the ventilators for the ICU. We'll be there talking about anesthetic machines for the, theaters. But I think without the right talent to be able to manage, to design these devices, to maintain these devices, to adapt these technologies, these particular devices that we refer to as MedTech are simply very expensive furnitures for us. And that's why we find ourselves having them junked in a certain place without support and without really understanding where are we supposed to take them. So I was trying to really research what exactly are the key challenges that we are facing as Africa and how can we be able to man those particular challenges. And I came up with 3. The first one is skills gap. We graduate a number of engineers, we graduate a number of innovators, we graduate a number of potential talents. However, there's very few instances whereby these talents are trained on the health technology management, on the regulatory systems. We had very good regulatory team here talk about regulation, but that is actually not taught in African universities to be able to empower or to equip these particular talents to understand how to manage or to go about their innovations as they grow up in their career. And we also do not really have user-centered designs in our country. The other thing, allow me to remember what one of our colleagues said here. That was the Ethiopian colleague who requested the Ethiopians to go back to their country and do innovations back in the country because he felt there were so many Ethiopians in the room, right? And he said, please, I have a request. Can you come back home so that you can be able to support us in doing innovation? And this is not only Africa to Africa. We also have very good, talented team actually moving abroad for better opportunities. And then we leave our local systems without anything, with so many unique challenges because our best brains have been shipped abroad for better opportunities. The other thing that I also came across was the underinvestment in the talent pipelines. I know we have a lot of funders. Right now, everybody's talking about we can fund you, to develop this. We can fund you to develop this device. You want to do, diagnostic devices. You want to see how AI can be able to help us, which is really, really very key. But the funders are also really not investing in those people who make those devices useful, safe, and sustainable. Because we can innovate as many as we can, but again, I will still go back and say, if we do not have the right people who will be able to, advise on the usefulness of these devices, advise on the safety, and also sustainability, then these devices that we are innovating today end up to be very, very bad furnitures for us. And what are some of the opportunities that are available? A number of researchers have actually indicated that Africa has the youngest population in the world. And one of the areas I was actually looking at one of the research that was indicating that about 40% of the African population is below 20 years of age, which is interesting, right? So that means that we really have a very big opportunity to be able to invest in the talent pipeline that we are having. We also have a very big expanding STEM education. Quite a number of universities are now really training on innovation and giving a lot of emphasis, even the government. Various African governments are giving a lot of emphasis on the STEM education. And there's a very high rising number of STEM graduates. So that is an opportunity that we can actually, be able to tap. And of course, we have a very high growing healthcare demand. The growth rate, population growth rate in Africa is very high. So we can actually, that is an area that we can actually be able to tap into and just see that we have a very high demand now and forever. We are not going to expect the healthcare demand to go down in Africa anytime soon. And so I was looking at that particular picture on the side, and you're seeing that I was looking at investment in healthcare, and that is according to one of the research that was done by African Ventures. And they were saying the highest number of people are actually investing on the supply chain. But I went down on that, I went down on that particular graph, and I was able to see the talents is like way down, down there. Very few investors invest on the talent. A number of them will actually be investing on the devices, supply chain, or primary healthcare. But how about the talents that are working on the innovation? So if we invest in talent now, we don't just solve today's MedTech problems, but we are future-proofing our healthcare systems. So I was talking about having been privileged to go to a number of hospitals in Africa. And I think I can't count a number of times I've met very innovative and very vibrant, young, upcoming innovators working on the medical devices. And I remember there was a case in time whereby I went to one of the hospitals in the remote area. There was one upcoming biomed young lady who was working on an incubator that had been down for 2 days. And, in a number of facilities in Africa, a number of facilities are having like more than 2 babies in one incubator because they don't have sufficient incubators to have, each baby, regardless of the infection prevention measures. At times it overrides that, and they just say, what do? I have 4 babies who requires this device. So I have to put all of them together. So this girl was up and about working on this incubator, and I remember her saying that I worked on this. I didn't have a night's sleep because I was working on this. I went online. I tried to reach out to the networks, and she was able to have this particular device fixed. And what she was telling is that particular week, that particular incubator was able to save 3 babies. So I'm imagining 3 lives would have been lost if this particular incubator was not sorted by this particular lady. And that photo aside there is one of the hospitals in Kenya. We're having one of the biomedical engineers working on the oxygen plant. And I remember during COVID-19, it was such a serious scenario in a number of countries, and Kenya was not excluded. And we had a number of plants going down. We didn't have many plants at that time, but the few hospitals which had oxygen plants did not really have them functioning well because the demand was very high. This particular biomedical engineer spent his day and night working on this oxygen plant, and a number of patients were actually saved during that time because they were able to produce their own oxygen in-house. And so there are quite a number of countless innovators in Africa who do not wait for permission to solve problems. They adapt the devices to work in rural clinics without steady electricity. They design a lot of frugal innovations from locally available materials. They train nurses to troubleshoot basic device errors so that care is not delayed. But look at this. If these people can actually be able to get good mentorship, proper training, proper funding, and everything that is required to develop talent, we'll be very far as a continent. Allow me to share my vision with you today. Apart from just having to ensure that we support the talents and also ensure that we sustain, I have a vision. And I would want us to share the vision together. And my vision is by 2030. We're in 2025. By 2030, I vision every public hospital in Africa having a skilled biomedical engineer integrated into decision-making, not just repairs. In my current work, I also have an opportunity to mingle with so many biomedical engineers, especially in the public sector, who are working on biomedical engineering devices. However, this particular team of engineers are only engaged or involved during the repair works. But the device comes in, they are not aware. The specifications are given, they are not involved. A lot of needs assessment is done, they are not involved. Then when the machine breaks down and there's emergency at the hospital, that is when they come in. But I'm visualizing and I'm looking at a situation whereby, and I'm very specific about public hospitals because I've also been privileged to work in private hospitals, and private hospitals are a bit aware of the importance of the technical and the innovators in the market. So I'm looking at a situation whereby all the public hospitals will be having biomeds and technical skilled biomeds as decision makers, sitting on the decision-making table, not just repairing devices in the workshop. And by 2035, I've added more years on that, like 5 more years. I'm looking at an African-led MedTech companies designing at least 50% of the technologies used in our healthcare system. And I know we are capable of doing that. We have a lot of frugal innovations, people using solar-powered systems to operate in very rural areas. So there's quite a lot of innovations that African talents have been able to. But because there's no proper systems, you find that those innovations do not see the light of the day. But I'm looking at African-led MedTech companies, producing and designing 50% of the technologies that we are using in our healthcare system. And most importantly, we are looking at talent not being a bottleneck for us. So, by the way, this is not just a dream. It's a design challenge. And so for us to have a proper MedTech ecosystem, I'm looking at the team of academia, industry, and policymakers working together to be able to support this. And so how about the funding models? I know the funding models, some people, very good funders have been here, and they're very keen on ROIs for the devices that have been purchased, but there are no measures for the engineers that have been trained, the jobs that have been created, and innovations that have been deployed. So we are looking at not only ROIs for the devices purchased, but engineers trained as also a measure part of it. And as I finish, I give us a call to action. And this goes to all of us, everybody in the room. So if you are an educator, I challenge you to design programs that blend technical skills with entrepreneurship and health systems thinking. If you are an educator, because I know we have universities here, we have training teams here. But if you are an investor, because I also know we have investors in the room, invest in talents the way you invest in technology. The way we give a lot of effort in technology, please also invest in talent. And finally, if you're a policymaker like the government officials we had around, please create frameworks that make African MedTech talent not just visible but indispensable. And so I'm imagining an Africa future MedTech that is imagined here, built here, sustained here, and not imported. That is the Africa MedTech future that I'm looking at. Everything done here locally, no importing. That is the future. I hope you'll all be there to see that future come to pass. And as I finish, I will finish by a quote that says, Africa MedTech's future is powered by people, not just technology. Thank you very much.